So welcome everybody, guys. I'm Dr. Cordero, one of the aesthetic doctors that will teach you also during your stay in Madrid. Hopefully we will meet over there. So it's a pleasure to welcome to this master's degree in aesthetic medicine. And we wanted to share this little presentation because I don't want to overwhelm you. That the idea is not only to present you general information about your career opportunities as an medicine doctor, but also to allow you to ask me any questions, because I think it's very important, not only the information, but also to understand the posterior possibilities you can have as an aesthetic medicine doctor. Okay. As you might know, we have plenty of opportunities because it's a very wide specialization. And my idea with this presentation was to explore with you the different job positions you can get access after this master's degree, the different work environments that you will have depending on the branch you finally will decide, as well as the growth opportunities in this fantastic world. Okay. The agenda for today, very easy. First of all, I wanted to make an introduction on the required qualifications and training you should have in the different countries. My experience as an aesthetic doctor is not only limited to Spain, but also to the UK, because I work and live in London, and I practice both medicines in both countries. So I think it's going to be useful for you. We also are going to discuss the different core career pathways you will have after finishing the master's degree, as well as the difference between being a private practitioner and being employed by an aesthetic clinic. Okay, the different specialization areas within the aesthetic medicine, business opportunities, research opportunities, plenty of different challenges and considerations you will need to take in order to become good specialist, as well as how can you decide on your professional development and the next steps. And finally, some message to take home today. Sounds good? Sounds interesting? Shall we start then? Perfect. So what is the aesthetic medicine? You know that it's a specialization focused on minimally invasive treatments to enhance the appearance from the skin, face, body, without using any type of surgery techniques. Okay. Very common procedures nowadays. Everybody is informed about these possibilities. Things like Botox, fillers, chemical peels, skin rejuvenation, lasers, and those kind of things. Okay. So in order to become a doctor focused on this specialization, I will strongly recommend you to review the requirements on your specific country, because I know that most of you are coming from Poland, and I've put on the presentation the requirements according to the website I've consulted. Correct me if I'm wrong, because I'm not Polish and I haven't practiced medicine in Poland, unfortunately. But that's why I strongly recommend you to review everything. But in terms of the UK or Spain, which are the countries I have worked at, you can see that the requirements are completely different. For instance, in the UK, you can see that after the medical degree or a nursing degree, and being registered either with the Chamber of Physicians or Dentists here in the UK, which is called GMC, General Medical Council, or the Nurse Council, you can get access to becoming an aesthetic medicine doctor, even if you're not a doctor. Okay. That's why plenty of different people can get access to this specialization, and that's why the competence between different clinics is huge nowadays. Okay. In Spain, only doctors can become aesthetic doctors, not odontologists, not physiotherapists, no nurses, and of course, no other health careers. Okay. In Poland, I think it's exactly the same as in Spain. You need a medical degree, registration with the Polish Chamber of Physicians and Dentists. I couldn't, even if I try, pronounce that word in Polish. That's why I have written it. And also you need a master's degree on aesthetic medicine. Either this one you have selected or any other different. Okay. In terms of basic skills you should have in order to become a good aesthetic medicine doctor, you're going to need strong clinical skills. Leave that with us, because during your training, our idea is to for you to do a lot of practice, try with different patients, of course, under our supervision, and those skills will come to you very slowly but steadily, okay? You will need to have a detailed knowledge of facial anatomy. That's why I'm really, really keen on remind you that studying the theory part from the masters is extremely important. Otherwise, you're not going to be able to follow the recommendations and our tricks and our steps during the practical sessions we're going to have together. I'm afraid you will need to develop your communication skills, and you will need to focus on a care center on the patient, okay? These patients are extremely delicate with a very delicate psychology as well, and that's why you will need to communicate very well. But I think this is something that comes along with the medical profession, so I'm not really worried about this part. Of course, professional judgment, you will need to follow some rules of good practice, try to avoid complications, and know how to sort those complications out in case they happen. But don't you worry, because we will cover these parts during the practical sessions on Madrid, okay? And finally, extremely important, I remark it in black, in bold letters, business skills. I know it sounds weird, especially for doctors, because we are not very used to these kind of things, but having some knowledge about business could be extremely useful, because I know that as doctors, you are very used to receive patients every day without going outside and look for those patients. Is something that basically appears into your consultation rooms without you doing any type of research or investigation or work. But in aesthetic medicines, it's right the opposite. You will need to look for those patients. You will need to go to the streets. You will need to advertise yourself. You will need to put yourselves on lists in order to bring patients to the clinic, and also to keep your patients in the clinic, okay? In terms of different core career pathways, you can practice on a private practice or as a freelance or mobile aesthetic doctor. This is only applicable to the UK. I don't know if in Poland you're entitled to do legally this mobile aesthetic doctor, which means you can go to the places, to the houses of different people or patients in order to deliver different treatments. In Spain, it's completely forbidden, but here in the UK, you can arrange these kind of sessions, which are very interesting because it allows you to gather a group of people, and in one evening treat plenty of different patients, with some implications, because as you can imagine, it's not as safe as in a clinical environment. So that's why in Spain that they have forbidden this possibility. You will need to consult with Poland or different countries if this is allowed. You can practice your medicine in a hospital department, but it is completely true that the amount of departments or hospitals that have this service are quite few, as it is not a main concern in terms of health, or sometimes the dermatology department covers these possibilities, or the plastic surgeons. So that's why you're going to find limited positions in the hospitals. Or you can become a trainer or an educator like myself for the professionals that want to become aesthetic doctors, okay? Also, you can have opportunities in the industry, in the business, or the pharmaceutical companies. You can, of course, open your own clinic or your aesthetic practice. You can help those pharmaceutical companies to develop new product lines, cosmeceuticals, devices, lasers, machines, everything. And you can work as a consultant for different brands or different business in terms of how to provide the training, how to deliver these products, how to help with the marketing plan, those kind of things. And finally, but not less important, some of you will dedicate your practice to research on new procedures, publications, papers, or development new creams, new treatments, new products, and those kind of things, okay? And helping and contributing to the scientific community. Specialization areas within the aesthetic medicine. You can focus on only facial treatments, injectables, fillers, lip enhancement, everything within the face. You can dedicate your work to body contouring therapies, things like fighting against fat tissue, helping with the contouring of the body, tonification of the muscles, helping in general with everything related with the body, including all the regenerative medicine and things such as gynecology and those kind of treatments, but I'm not going to go into that because it will be covered during the masters. You can also focus on wellness, anti-aging, or how I prefer to call it, better aging, okay? Through nutrition, supplementation, spas, well-being centers, combination of different treatments, exercise, those kind of things. You can focus your career on those kind of things, which is a pretty interesting branch, because you know that genetics are playing a fantastic role into this kind of world, and it's becoming very, very interesting. And finally, the amount of lasers, medical devices is increasing a lot, especially since Korea has started to develop their own lasers and those kind of things. And you can focus on laser if you prefer, which is a fantastic world. You will need to learn something else about physics and those kind of things, but it's a very interesting way of delivering the aesthetic medicine, okay? What about the difference between being a private practitioner, as myself, or work for a clinic employed? As a private practitioner, flexibility is higher. You can decide when to work, how to do it, and when to see patients and how many patients that you want to see. So you're going to have full autonomy in deciding who you treat and who you don't like to treat. The income potential is higher, but also more unstable because it will depend on the amount of patients you will have. But negative or downside is that you will need to prepare for everything. You will need to advertise yourself. You will rely on the number of patients you will have. And as I have said, it's going to be more unstable than working for somebody, okay? And of course, the amount of administrative stuff that you will need to carry out, it's going to be higher. In compared to working for a clinic as an employee with a contract, you will have your working shifts, you will have your patients already decided by the clinic. You can have some autonomy because in general, this is not going to be your main job. So as a side job, you can decide how many days you want to work for those clinics. You can negotiate those kind of things. So it's not as bad as your main specialization in general. The income potential is a little bit lower because as they're going to take care of you, you will need to share some benefits with the clinic, or you will decide the percentage of income that you will have seeing those patients, okay? But also they will help you with things like admin, booking the appointments, getting in touch with the patients and those kind of things, okay? Different challenges you're gonna find and some considerations that are interesting to remind you. Depending on the regulatory compliance or the legislation of your country, you will need to have a look into this very in detail. It's not the same, as I have mentioned, to work in the UK in compared to Spain. Practice is completely different. But also, not only this, I haven't said anything, but also the requirements from the patients are completely different. Some of the patients in the UK have completely different approach to aesthetics in compared to Spanish women, and I suppose it will happen exactly the same in Poland. You will need to have indemnity insurance. This is non-negotiable. If you have a complication and you're not covered by an insurance, you're going to be in trouble. So please, the first thing you will need to check after the compliance and the legislation would be the indemnity insurance, okay? And finally, careful, but this is something we will treat during the masters in person in Madrid, with the expectations from the people. Not everyone is the same. Some people tend to think that aesthetic medicine will change their faces completely as they see on TV or in the cinema with famous actors and those kind of things. Please educate your patients. Tell them that this is going to be a push, this is going to be a help, but never a complete and full transformation, okay? And be mindful of the ongoing competition, which is becoming higher and higher. The amount of doctors that are becoming aesthetic doctors is absolutely crazy. So you will need to be relevant, be different from the rest of them in order to have space or have a possibility of developing as a specialist in this field. Okay, and that will go through a continuous education. The master is the first step. You will need more training, of course. As I've mentioned, imagine you want to become a laser specialist in the future or medical devices specialist. You will need further training. So you will need to build a reputation through coming to conferences, join professional bodies, read papers, and those kind of things you already know from your medical school and your previous specialization. Okay. Take home messages before you can start asking me any questions. It's a very, very rapidly expanding field that will offer you plenty of different opportunities. You can earn a lot of money through this specialization. You can have a very good balance between work and life because it will allow you not to stay in the hospital all the time. And also, in general, is a specialization that will give you a lot of headaches, as most of the complications are extremely unlikely if you do the things well. Okay, you will need to have your certifications and you will need to be committed to continuous learning. I never stopped learning since I have finished my specialization in aesthetic medicine. I still go to conferences which I see new techniques. I read papers that have informed me about different side effects, how to manage those complications and those kind of things all the time. As you have seen during the presentation, the different options of career are huge, very varied. It doesn't have to be facial as everybody does. There's plenty of opportunities in body treatments. There's plenty of opportunities in regenerative medicine and well-being. So don't get constricted to the only techniques we're going to cover during the masters, because you can expand your knowledge all the time and you can learn about new things that maybe we're not able to cover during the master's degree because we cannot cover everything. Okay, it's a very fulfilling field because it's not only artistic but also comes along with a lot of science, hand to hand. So you're gonna practice a completely different way in terms of medicine. You're gonna love it, I believe. But it is very important to keep a strong reputation because as I have mentioned a moment ago, there's going to be a lot of clinics very, very soon, and you will need to be leaders in the field. Okay, and that's it. Focus everything on the patient. Try to bring a lot of attention to the patient, and this is fundamental if you want those patients not only to come to your clinic but also to stay with you for long periods.